This is Jerry Hesch. This is part 2 of a type of sacroiliac joint dysfunction named sacrum stuck in posterior glide. So this is part 2. We finished treating her, so it's been about 10 minutes, and we're now ready to take a look at the pelvis, and we were successful in improving mobility in the pelvis, and as predicted, the upper neck did in fact free up. I'd like to do some more work on that upper cervical spine so it's not as free as is ideal, so we can make more gains there with direct treatment. She did have a fairly interesting response, so we will let her share that with you, but first we'll show you what the spring test revealed. Thanks. Here is her sacrum. And now I let go of that. Okay? So I take up the slack. Now watch this. I push it to an end point. And I maintain that end point throughout repeat springing. 1, 2, 3. And now I'm going to let go of that end point. Okay? Do you want to visualize her feet? No, well, yeah, please. I'm going to push, I'm going to come on what I call the posterior iliac shelf. And I'm going to push inferiorly. And I think you'll be able to maybe show the ilium move, the pelvis move. That's adequate. That's all we'll do. Okay. You see me okay? That's incredible. That's a lot of movement. That feels like normal physiological movement. And now I can spring it repeatedly. And the force goes all the way down to her feet. Her heel is bobbing up and down. Before, I couldn't get through it. And now I'm going to let go of the slack so you'll see that recoil. Okay? And the same thing with the sacrum. I can do an inferior glide on the sacrum and it moves. I'm going to do a superior glide on the ischial tuberosity. And there was absolutely no motion here before. I can get some movement there. And when I spring it, it goes through the body instead of being blocked. Now some people would argue that this is not the sacroiliac joint, and that's okay. I'm very comfortable with that conversation. We're still, even if we're not changing motion inside the sacroiliac, we're restoring normal physiological motion of the pelvic structure because it moves in three-dimensional space, loaded with lots of soft tissue behind the sacroiliac joint. And those tissues can change tone and block mobility external. So I'm very comfortable with saying, yes, it's the sacroiliac joint, or no, it's not, it's something else. No problem. So we'll have her lie on her back, and then I'll show you a couple more spring tests. I'm going to do a lateral glide now. Okay, so I take up the slack, and then I impulse it. And it definitely moves. She's ticklish, so I got to be careful here. And I can definitely take up the slack and spring it. Let's spare her the ticklish. And if I come here, I want to spring it inferiorly. So I take up the slack, and I wait a few moments. 1, 2, 3, and there is definite movement. And now I let go. Okay, well that has much to do with the nerves that are called mechanical receptors. There's 4 of them. And these nerves innervate connective tissue, fascia. There's a similar kind of nerve that innervates muscle. These nerves innervate ligament and joint capsule. So we're changing lots of receptors when we do this. We're changing muscle receptors, we're changing muscle function, and we're changing some of that reflexively by changing the tone of ligaments, fascia, joint capsule, etc. So there's the demonstration of improved mobility, but the question is, what function does that enhance? And I'm going to defer to the client and ask her what her response to only this treatment is. And go ahead.
Oh, it doesn't hurt anymore. And it's much easier to walk.
Okay, can you elaborate on it doesn't hurt anymore?
I was having a pinching, burning all through my lower back and when I would walk, it hurt.
And when you
it's
walked,
gone.
it hurt in the back?
Uh-huh.
Okay. And then your second sentence was that it's easier to walk.
Mm-hmm.
Can you explain that, please?
Well, it doesn't hurt, so you can walk more and you can go farther.
Okay, okay. Anything else?
No.
Okay. And any influence on your neck in response to treating the pelvis?
A lot. There was a lot, because I can really move my neck around a lot.
In which direction can you move it? In which direction is it most improved?
I don't know.
Okay. If I were to guess, I would...
Probably to the left.
Exactly. I would guess it to be rotation. Because in the uppermost joint, where the atlas connects to the occiput, there's very little motion there, 10 degrees or less. However, when you come to the second vertebrae, that one rotates to the left 45 degrees, and it rotates to the right 45 degrees. So you can have someone, their whole neck is fused, but if the top two still move, they still have this much motion. Okay. Now, L5 is locked up. She has some pathology between L4 and L5, and the reason is the back of the sacral facets point posteriorly. The lower part of L5 articulates with that, creating the lumbosacral joint, lumbosacral facets. So if the sacrum was glided posteriorly, it tilted L5 a little bit, and it moved L5 in posterior glide. So we know that L5 was not moving, and her pelvis was not moving, and I submit to you she had a lot of forces going up at L4, and so that would make her vulnerable for more L4, L5 disc and facet trauma. And in summary, the key to unlocking her upper cervical spine was in fact treating the pelvis, and we only treated the pelvis. We restored movement in the ilia, and we restored movement in the sacrum, and if we went to the front and tested the pubic bones, the symphysis pubis joint, we would find that she would have been blocked, and we would find that she now has physiological motion, which is very, very small, but nonetheless there for a reason, and has everything to do with function. So I think this is a good place to stop. I've been most anxious to get this kind of a presentation on film, because this is a pattern that's not well understood, and I don't think it's being taught in the seminars that happen all over the country. And so it's a really delightful opportunity, and I'm very grateful for the person filming and for the client. Thank you very much.